The Faculty of Nursing at the University of Alberta is one of the largest nursing faculties in the country and highly ranked in world university rankings. The faculty is a pioneer in Canadian nursing education, the first to implement a Master of Nursing program in the West in 1975, and first to implement a fully funded nursing PhD program in 1991. We are preparing leaders in nursing who make a difference.
The Faculty of Nursing is located in the Edmonton Clinic Health Academy. The building, situated at the heart of one of Canada's largest health communities, is where the Faculty of Nursing, alongside 11 other health sciences departments and units, lay the foundation for groundbreaking interdisciplinary investigations in health, education, and research. Although only 5 stories high, the ECHA structure is colossal, at 500,000 square feet and the length greater than 2 football fields. The space, used by upwards of 3,000 students on any given day, in the building's 70 teaching facilities, hosts decor using a full spectrum of color, representing a kaleidoscope of possibilities through interaction and integration. The first, second, and lower levels offer students plenty of natural light, comfortable common areas, and private study spaces, as well as a large cafeteria. The top 3 floors are filled with faculty offices, 2 beautiful atriums, and Discovery Mall, an area assigned to research teams and designed to be highly flexible with moving walls to foster collaboration and customizable workspaces.
Today we will tour the Nursing Simulation Center known as NSC, a state-of-the-art space where undergraduate and graduate students engage in learning using standardized patients, low, medium, and high fidelity simulators, task trainers, and an extensive collection of anatomical training models. At just over 14,000 square feet, the NSC provides a sophisticated, simulated clinical environment that allows students to participate in learning experiences that are highly challenging and realistic to the complex clinical setting. On a weekly basis, there are over 1,000 nursing students that utilize this space for skill acquisition and development. Down the hall are the 6 learning labs, 2 of which have been named: the Rita Arnell Learning Lab and the Jack K. President Apotex Inc. Mental Health Learning Lab. There are 4 more naming opportunities within the center. Each of the 6 learning labs include 8 or 9 working stations equipped with beds, functioning head walls, overbed tables, bedside tables, and privacy curtains. Each working station replicates the hospital environment and adds to the realism of the learning space.
This is an instructor demonstrating an IV start in the arm of a task trainer. The IV task trainers contain veins and simulated blood to mimic a lifelike arm. Students have the opportunity to insert a needle through the skin into a vein and observe blood return as would be seen in practice. After insertion, the line is flushed, secured to the skin, and may be used for administration of fluids and medications throughout treatment.
Students will have the opportunity to practice on the same medical equipment that they will work with in hospitals. This includes smart IV pumps, tube feeding pumps, bladder scanners, glucometers, ECG monitors, medication carts, and resuscitation or crash carts.
This is an instructor demonstrating an intramuscular injection into the medium fidelity simulator. The medication is drawn up into a syringe and needle and administered into the deltoid muscle in the upper arm.
Each lab skill is taught by an experienced nursing instructor who facilitates the integration of the theory to the psychomotor skill prior to providing dedicated time for supervised practice by the students. Medium fidelity simulators, known as nursing Kellys, are used in these labs as patients. These nursing Kellys have accurate anatomical features to create realism. This allows an exceptional learning opportunity to perform basic to advanced patient care in a realistic yet risk-free environment.
This is an instructor demonstrating a complex wound irrigation and dressing on the abdomen of a medium fidelity simulator. This is a sterile procedure using a sterile dressing tray, sterile gloves, and a sterile irrigation solution. The open wound is irrigated with the saline solution and then moist gauze is placed into the wound. It is then covered with an outer sterile dressing. In practice, this procedure would be done several times a day.
In addition to the learning labs, the NSC has a high-fidelity simulation suite with 5 clinical simulation rooms, 5 control operator rooms, and rooms available for debriefing. The clinical simulation rooms are home to high-fidelity simulated patients ranging in age from infant to adult, including a birthing simulator. These rooms allow students to have experiential learning opportunities. The simulation operator is a registered nurse who operates the simulated patient. The operator is able to program lifelike features such as blinking eyes, pulses, voices, breath, and heart sounds, and will respond to the nursing care provided by students. Before a simulation experience, nursing students are made aware of the simulated patient's name, medical and social histories, admitting diagnosis, and prescribed medications.
During a high-fidelity simulation, the student groups begin with a briefing by the instructor. All students take turns to participate in the scenario that replicates an actual clinical situation. Students work in pairs to provide nursing care to the simulated patient. The rest of the students observe the experience via a live video stream in the learning lab. After all students have taken a turn to run the scenario, the instructor facilitates the debriefing discussion. Most student learning occurs during the debriefing rather than the actual simulation. Students can reflect, discuss, and confirm learning outcomes, and later use this information in their nursing practice.
The clinical simulation birthing room is home to Noelle, an obstetrics labor simulator that is designed to provide a complete birthing simulation experience, including before, during, and after delivery. The supply room is a well-organized, essential space within NSC. Consumable supplies and resources are organized by skill and are accessible on carts around the perimeter of the room. The consumable supplies are the same used in the hospital. This helps students prepare for their clinical experiences. There is a large selection of low-fidelity simulators such as blood arms, wound models, injection pads, and more. The Genevieve I. Gray Anatomy Lab and Meeting Room is full of human anatomical models, posters, bones, and references. These models allow for an accurate visualization of the human body and its systems. Since our founding in 1918 as Alberta's first university-based program in nursing, the Faculty of Nursing's aspirations and actions have been guided by core values drawn from the discipline of nursing, the university community, and Canadian society. The faculty has more than 330 academics and staff working on 114 active research projects and 51 research grants in areas of excellence that include chronicity, health equity, health systems, and nursing education. There are over 1,300 students in our 5 undergraduate programs leading to a Bachelor of Science in Nursing and over 100 graduate students pursuing a master's or PhD. This diverse population represents 29 countries worldwide. The faculty's commitment is to be pivotal in advancing nursing and health through interdisciplinary and intercultural learning. The faculty has been and will continue to make a difference in nursing education.
Thank you for taking this virtual reality tour of the Nursing Simulation Center, and we hope you join us in the coming year, the celebration of a century, marking the milestone of 100 years of nursing education at the University of Alberta.